is Lexi. I'm going to be your student nurse today. Can I get your first and last name and date of birth?
Jack Jackson, 11/22/1979.
Okay, perfect. I'm just going to get signed in here, and we're going to be doing a IM injection. So I'm just going to scan your wristband. Make sure I got the right patient here. Okay, Jack Jackson. And Jack, what are you allergic to?
Penicillin.
Okay. So it looks like we have one scheduled IM injection of prochlorperazimine. So I'm going to do my first check. We have 5 milligrams per 1 milliliter of the prochlorperazimine, and then I'm going to perform hand hygiene and identify the different sites. So this is the deltoid. To find that, you find the acromial process, go 3 to 4 fingers down, and then that muscle right there would be a good injection site. That can hold up to 2 milliliters of fluid and requires a 1 to 1.5 inch needle. The next is the vastus lateralis. Find that, you put a hand below the groin, a hand above the knee, and then that inner third portion right here would be where I'd give that injection. And that site can hold up to 3 milliliters with a 1 to 1.5 inch needle. So today we're going to be giving it in the ventral gluteal site, so I'm just going to turn you on your side. Let's find that location. So to find that, I'll put my palm on the greater trochanter, which is right there, with my thumb towards the groin, and then I'll sweep my fingers back, and that spot right there is where I'll give that. I'll find the top of the iliac crest with my fingers, okay? And that can hold up to 3 milliliters with a 1.5 inch needle. Okay, so now that I'm done with that, I will perform hand hygiene again and gather my supplies. So I'm going to wipe the top of the vial off with the antiseptic wipe for 15 seconds. Okay. I need a 1.5 inch 22 gauge needle, 3 milliliter syringe because we're giving 1.5 milliliters, some gauze, a Band-Aid, and a 18 gauge pull-up needle. So now I'm going to do my second check against the MAR, 5 milligrams per 1 milliliter. So that looks good, the label. And now I'm going to clean the top of my vial. Scratch that first one for 15 seconds. Okay, let that dry. I'll set up my syringe. This one has a cap on it, so I can set it on the table. Okay, so I'll pull up 1.5 milliliters of air into my syringe. Pull off my cap. Inject the air into my vial. And draw up. Pull up a little past so I have room to get the air bubbles out. Okay. Okay. So there I have my 1.5 milliliters. For this video, we can't inject into our patients, so I will put the med back in. Okay, and then I'll throw my needle in the sharps and put on my injection needle, which is a 1.5 inch 22 gauge needle. Okay. And then this is where I will do my third check. Scan the med in. I have 5 milligrams per milliliter of the prochlorperazide. So given, do 1.5 milliliters in the left. Okay, and left ventral gluteal. So I will put my gloves on. Okay, Jack, so I'm going to be giving you an injection in your ventral gluteal site. It's going to just be a slight pinch. We'll be done. Let me know if you need anything during the procedure. So, I'm going to find that site again. And right there. Where I'll give that injection. So I will clean it off from the inside out and mark it about 1 inch away. Needle. Gonna Z-track and inject at a 90-degree angle. Aspirate for blood. There's no blood. So I'll inject slowly at 1 milliliter per 10 seconds. Then I'll pull my needle out, release my Z-track, apply gauze, and activate my safety. Okay, there's no bleeding, so I don't need a Band-Aid. I will dispose of my supplies. Put my needle in the sharps container and assist my patient back into a comfortable position. Okay, Jack, are you comfortable?
Yep.
Alright, here's your call light. I'll lower the bed down. And then I would chart the route, dose, site, time, and date of the medication given. And then I would also record my patient's response to the injection.